Now I'm privileged to introduce someone who has been active in protecting women's reproductive rights for many, many years. And this is the Reverend Dr. David Ames, who is an Episcopal priest. David.
Thank you, Jim. It's really an honor to share in this press conference with wonderful people like Camille and Sabrina, and of course, my friend and colleague, Sarah Mack. Several years ago, prior to Roe versus Wade, I served as a member of the Clergy Consultation Service, a national organization founded in the late 1960s in New York City. Its purpose was to provide counseling and support for women struggling with problem pregnancies. At the time, abortion was illegal because it was unsafe and rates of morbidity and mortality were quite high. Self-induced abortions, among others, led to sepsis and often death. Then, with the passage of Roe versus Wade, women had the right to choose, and as a result, pregnancy terminations could be accomplished in medically safe clinics under the care of physicians and other healthcare professionals. As far back as the 19th century, clergy were at the forefront of advocacy for the family planning movement in the United States, just as religious leaders continue that mission today. With anti-abortion groups now receiving much attention, many of my colleagues and I disassociate ourselves from those restrictive voices that bear witness to the diversity in religious teaching regarding the purposes of intimate relationships. We recognize that no single religious leader speaks for all people of faith, and we protest the enshrinement of any faith tradition or authority as public policy. We affirm the value of new life when we protect the capacity of women to determine when and if there is a proper time to become a parent. Clergy and community members from a variety of faith traditions affirm the sanctity and sacredness of life by endorsing laws and policies that provide access to comprehensive reproductive health care for women and families and medically accurate, age-appropriate sex education for teens. My years of experience, along with fellow clergy and professional counselors, in providing pastoral care to women and families demonstrates the significance and importance of reproductive health care and family planning. Government officials have no business imposing their personal faith and moral restrictions about medical services into legislation that restricts moral decisions affecting our private lives. All people of every sex, gender, and transgender need medically accurate information, the opportunity for personal deliberations, and access to the level of care they believe is right for them. As Roger Williams demonstrated in the founding of Rhode Island, individual conscience was and continues to be the moral high ground. So I join with others in advocating for policies and legislation that safeguards and strengthens access to reproductive health care. The work of women's health centers, including Planned Parenthood, in providing quality and affordable medical care and comprehensive sexuality education is vital and commendable for the well-being of every Rhode Island citizen. Thank you.